do that, I have Dr. Akila Subramaniam. She's an assistant professor of maternal-fetal medicine at the University of Alabama, a specialist, OBGYN, and she's here to help me answer some questions. So Akila, thank you for being here with us.
Yeah, thanks for having me.
Now, first and foremost, let's talk about COVID and its impact on pregnancy and its impact on both the pregnant person and the fetus.
Yeah, so I think, we now have about 18 months of time where we've seen, especially for what I do, taking care of just pregnant women who have acute conditions, been able to gather some data over the last 18 months, not just at our institution, but nationwide and really globally. And so we have a pretty good sense of how pregnant women are being impacted by the COVID virus, both in the first stage back in early March and April, up to now where we're now facing this Delta surge. And so when you ask what we're seeing, it has changed actually quite a bit over the last 18 months. I think, down here, being in the southeastern part of the United States, the very first wave that we saw really impacted parts of the Northeast as well as the West Coast. And less so here, but we saw a lot of women who had asymptomatic COVID. So if you look at some of the studies done by the Maternal-Fetal Medicine Units Network, which is the largest research network in this country, has over 10 sites. The large number of women who were COVID positive and pregnant, over about a half were asymptomatic. And the rates of critical illness or severe illness, so ICU admission, needing respiratory support, were pretty low. So a lot like early in COVID, there was a lot of asymptomatic illness. What we've seen, and I know what you guys have reported and what's been reported nationally, is in this Delta wave down here in the Southeast, what we're seeing, increased hospitalizations, much fewer asymptomatic patients, much higher numbers of critically ill patients as well. So not only were we seeing a disproportionate impact to pregnant women from COVID, they seem to be more symptomatic. Some of them are exceptionally sicker, but that also plays into account on their fetuses. So the mom and the baby are uniquely linked during a pregnancy period. So something that affects the mom affects the baby. So the simplest way to sort of look at this is oxygen status. So when mom breathes, mom gets oxygen. That is then transferred over through the placenta to make sure the baby gets oxygen for growth. Well, in the case of any respiratory illness, if the mom has hypoxia or does not have significant or sufficient oxygenation, well, that impacts the fetus as well. So when we talk about the neonatal or the fetal condition, it's really linked to how well and healthy mom is, whether the mom is sick, whether the mom is septic, whether the mom is dehydrated, not oxygenating. And so in any sort of illness, so if we take COVID out of the picture, in general, when moms are sick, babies can get sick. And we, earlier in the pandemic, we didn't see as much fetal impact as we are now, mostly because now these moms are sicker and more of them are symptomatic. And so what we're seeing is earlier deliveries for these fetuses. So we're having to, essentially affect delivery. So deliver the patient for fetal distress, for maternal benefit. And then you have a whole host of downstream problems associated with prematurity. You can have problems with hypoxia as well in these fetuses. And the thing that we're seeing a little bit more now than we were before is some placental changes and the possibility of an increased risk of stillbirth and abnormal inflammation in the placenta.
And definitely want to talk about that. But from the physiological point of view, when it comes to the mother in particular and the effects on her and the fetus as well, is this something that the virus is affecting mom, like you mentioned, which downstream affects the child? Is this something that it's actually affecting the placenta and it's attacking the placenta or essentially causing changes like you mentioned? Or is it even getting through the placenta and getting to the fetus? Do we know?
Yeah, and so that's really a complicated question. So what we have seen, there have been a lot of studies about, does the placenta have like the COVID virus particles? And I don't think it's been conclusively demonstrated that you see COVID in the placenta. So there are a lot of other infections that you can see in placentas, like syphilis, for instance, you can see in a placenta. Toxoplasmosis, you can see in a placenta, but we have not really been able to demonstrate, and this is from a variety of labs, that there's actual viral particles, so pieces of the virus in the placenta. But what we are seeing in the placenta is inflammation, so a reaction to illness. So you can see this in a number of different types of pregnancy-related issues. So things like preeclampsia, things like other infections in the amniotic sac. So if women have been laboring for a long time, sometimes the fluid around the baby can get infected, and you'll see the resultant effect or that inflammation in the placenta. And so what we're seeing is that inflammatory signs in a placenta, not necessarily viral particles. So a kind of a byproduct of what's going on.
When you talk to especially ICU doctors, they'll tell you that there's a huge difference in the patients they're seeing. And pretty much the vast majority of them are unvaccinated patients. Occasionally you have the breakthrough vaccinated patients. Is it the same in the pregnancy population, where the majority of the pregnant women you're seeing in the hospital, especially the ones that are having fetal issues or poor fetal outcomes, are they typically unvaccinated?
Yeah, I would say by and large, if we look at just our, institutional data, everybody that we have had in an ICU setting or it's been hospitalized has been unvaccinated. They have not completed the vaccine series, and by and large, they have not received a single dose. So it's not somebody getting infected between dose 1 and dose 2. And in fact, within our institution, we've only had 2 cases of breakthrough infections. And so those were 2 fully vaccinated healthcare workers who were infected, and they were largely asymptomatic, stayed at home. So, I mean, we don't have huge numbers to talk about those breakthrough cases. And we do see, if you look at non-pregnant women, so if you look at sort of national numbers, there are breakthrough cases that end up in the hospital. But I think more and more you're seeing, across hospital systems, they're putting, infographics of how many people are vaccinated, unvaccinated. The number is really quite distinct. And so that still applies to pregnant women who, by and large, the majority of our patients are unvaccinated. It's a very poorly vaccinated group of individuals.
And what are you hearing? Because, the CDC, it took them, and rightly so, because they had to wait for the data to come in, a while to start recommending vaccines for pregnant women. Is the uptake there, are pregnant women getting the vaccines, or there's still a lot of hesitancy? And if there is, what are they hesitant for? What are the reasons?
Yeah, I guess the first thing to talk about is, when was COVID vaccination recommended for pregnant women? And really, it's been recommended for pregnant healthcare workers since it's been recommended for all healthcare workers. So really, a large number of pregnant healthcare workers got vaccinated back in December. More strong statements urging widespread vaccination have trickled down since December, but there's never been a period of time since vaccination has rolled out where they have said pregnant women are not to be vaccinated, or we don't recommend them getting vaccinated. They've been all inclusive. So it's been very different than like young kids, for instance, that haven't been eligible for vaccination. So really for us, vaccination of pregnant women has been something that we have been recommending since all vaccination has been recommended to individuals. And like you said, stronger guidance has come out. In terms of why people aren't getting vaccinated, I think it's a really complex issue. So one is misinformation, and I know we'll probably talk about that a little bit, but one being misinformation. But I think if you look at pregnant women in general are always hesitant for vaccination. And you can see this just with some of the data that's been put out there with influenza. So it is recommended for pregnant women to get a flu vaccine during flu season. It's recommended for pregnant women to get pertussis vaccination to protect their infants, but uptake is really quite limited. So compared to the general population, and I think some of that hesitancy has to go with taking a medication or taking a vaccination or something, and the potential risk or perceived risk of what this could do to their fetus.
And this is always a bit of a hard one to talk about, because we know, or we have seen evidence that there have been preterm labor, preterm deliveries, low birth weights, those outcomes with women who had COVID while they were pregnant. But we're also starting to anecdotally hear, not just here, but I've heard from doctors in other countries as well, increased risks or increased rates of stillbirths, to the point where a lot of doctors I've talked with, OBGYNs, are saying, we didn't see that many in a given year. Now we're seeing, a year's worth in a month type of situation. Are you seeing the same thing, or are you hearing the same thing about increased stillbirths in women who are COVID positive during their pregnancies?
Yeah, we are hearing that too, and we're feeling it. I can't say if the data is conclusive about that at this time, but from what we're seeing here, we are hearing of more stillbirths in the first trimester, in the second trimester, in the third trimester than we did in the earlier parts of the COVID pandemic, and more so than we normally typically see. And talking to my colleagues across the country who are high risk obstetricians, they're seeing very similar things. So they're seeing higher rates of fetal deaths than they have before. And so you can't help, I mean, like I said, the data hasn't come out, but you can't help but wonder, hey, there is this association. It will take, sort of large amounts of registries to really put that data together conclusively.
And just looking at the misinformation that's out there, that
Yeah.
we've seen a lot of it, and you mentioned some of it, what are the biggest misconceptions that you're hearing?
Yeah, I think there's a whole host of them, right? So I think some of these things have been really quite debunked over time as so more and more information has come out. If we talk about just, I'll kind of talk about 5 different reasons that we see, maybe 5. But one is that the vaccination will cause me to have infertility issues. Well, there's
Right,
a
and that is probably the biggest thing I hear, that I get when I'm doing my Facebook lives or I get viewer questions, is that fertility issue. For some reason, that has really permeated the country. So please, what's the bottom line?
Yeah, and the bottom line is there's no data to suggest that this vaccine causes infertility, male infertility or female infertility. And I'm not sure where that data has come from. Very, very, very small early case series, but it hasn't been replicated in the larger studies that have happened. And kind of, going with that, there have been, some misinformation out there that the COVID vaccination causes problems with menstruation, and that could lead to infertility, but we haven't really seen that either. Other things that we hear is, for a long time when the vaccination was under emergency FDA approval, people sort of don't really understand how FDA approval works, and so the thought is that it's experimental. Well, it's not really experimental if you think of the fact that COVID vaccination has been administered to 3 billion people in this planet. That's almost half the world's population. And, we're not seeing the same number of reported deaths from vaccination as we are from infection. So I think that experimental piece, doesn't really hold water anymore since it has, full FDA approval. We're also hearing things like, microchipping. It's altering my DNA because of the type of vaccination it is. And so we're hearing all those different reasons, and as to why people are hesitant to get the vaccine.
A couple of things I'm hearing too is people saying, I had COVID, a year ago, and I'm getting pregnant right now. I don't need the vaccine because I already had COVID to cover me.
Yeah, and I think that's a little bit of errant thinking. There is that, so the virus changes, and there's a reason we get a flu vaccine every year, because it's different strains. And there's a reason that healthcare workers across the country, it's mandated that we get a flu vaccine. Not because we haven't been exposed to the flu, but what we do know about a lot of coronaviruses is the antibody response is very variable from person to person. So you get COVID, some people develop antibodies, some people don't develop antibodies. How long those antibodies last is also variant from person to person. So some may have it for a month, some may have it for 8 months. And then we have new strains. So really the most robust response to infection is vaccination, which is why, if you look at the history of mankind in the 21st century and the 20th century, we vaccinated against chickenpox. We vaccinate against all of these diseases and disorders that, really can cause some downstream effects, but vaccination produces a more robust response than natural infection. So for chickenpox, for instance, people get shingles after they have chickenpox naturally. You don't really get that with the vaccine.
And looking back again at the fertility issue, are there any vaccines that women are currently getting these days that have caused any issues with fertility?
No, and if you look at vaccinations in general, the reason that they're recommended and offered to a population is because they're found to be safe. None have been associated with infertility. I know there's a lot of talk out there about vaccinations and autism, but that's really It's a controversial topic, but hasn't really been proven. And, again, I don't think any vaccination has been distributed globally to the extent this one has, the three versions of this are. So you have a vaccine that's really well studied. I think people say, hey, mRNA vaccines are new, but they've been under development for 10, 20 years for other things. And the beauty of the mRNA vaccine is it's really easy to change to what your target is. And so this is not something that just last year was, developed in a lab and has never been tested. It's been tested in a lot of people and then tested pragmatically in the population.
And that's what I always say. It's not going from 0 to 100 miles an hour. It's going from 95 to 100 because they've done 3 decades of mRNA research and just now got to the point where they said, okay, now we're ready to develop the vaccine. And so they had a lot of prior history of research. But personally, do you have patients that got the vaccine February, March timeframe, so got the vaccine a few months ago and have now gotten pregnant, to dispel the fertility myth?
Yeah, I mean, I think we have at least the 2 breakthrough cases that I mentioned earlier in healthcare workers. Those are both patients who got vaccinated and then got pregnant. So, I mean, we're seeing pregnancies in vaccinated individuals. So that, I think if you talk about vaccine being made to the general population as in early this year, we're getting to the point where we do have vaccinated individuals who are delivering their babies.
And one of the reasons I bring experts on here is to give us the bottom line. And so I'm going to ask you a couple more questions. One is a bottom line question, but the other one is at the end, I always try to leave people with hope and with a bottom line of what your thinking is pandemic going forward. But right now, I always talk about risk benefit and weighing the risks of one versus the other. Dispel any rumors here, any myths here. COVID, much more dangerous, vaccine safe.
Yeah, that's true, right? So the risks of COVID significantly outweigh any risks of vaccination. There's just no question about that. And if you look at, every month, our obstetric journals are putting out information and research on COVID. And we're seeing that COVID vaccination is the best way to protect both yourself and those antibodies cross the placenta. So not the virus, the baby doesn't get the virus, the baby doesn't generate virus, but those antibodies that you get from having the response to the vaccination do cross the placenta. Now, they may not cross the placenta as robustly as maybe we thought, but they do, and so offer the baby the protection. And so I think if you look at the risks of vaccination versus a 2-fold or a 3-fold risk of a preterm birth, or even if we're talking about just a 10% increase in stillbirth, or even if we're talking about preeclampsia, those are much more common than any of the side effects that have been reported with vaccination, which are exceptionally rare. And the protection offered by the vaccination to mom, and then by protecting the mom, you're also protecting the baby. And then potentially you're getting this additional benefit of antibodies for your newborn. There's just no question what's the safest route to take at this point.
And so in your expert mind, expert opinion, hands down the vaccine.
Hands down vaccination. And I think that if you look at the different types of vaccination, there are very few reasons that people cannot get vaccinated. So I think that there's a lot of hesitancy if people have certain medical conditions, but the way that some of these vaccinations work, that doesn't really apply to these vaccines, this generation of vaccinations.
And Akila, like I said, I always like to leave people with that hope,
Yeah.
that bottom line going forward in the pandemic. What would you tell people watching right now?
Yeah, what I would tell people watching right now is the last couple months for someone who does higher risk obstetrics is challenging. We usually take care of very complex patients and that have a lot of comorbidities and risks to the baby. And this has presented a new challenge for us. And I would say the amount of work that the media is doing covering this issue, especially in the southeast parts of the United States, has really gotten people to start getting vaccinated. People are getting vaccinated because they're hearing some of these stories about newborn infants who no longer have a mom and a dad, who don't have parents because they both died of COVID. And we're seeing that, throughout the Panhandle and throughout the Gulf Coast. But I think that if you look at rates of vaccination, they are increasing in some of these areas as a response to what people have been seeing. And I think that, we're sort of starting to maybe see our numbers plateau. And some of that has to do with that increase in vaccination. And, I know people are tired of this and people want to go back to normal life, but there's a way we can do that, and there's an option for it, and it's safe. And I would urge patients and pregnant patients who are worried to talk to their obstetrician about it, and talk to a high risk obstetrician about it, because there really is an out of all of this. And the sooner we all get vaccinated, the sooner we get to return back to normal.
Excellent. Well said, Akila. Thank you very much. Thank you for your time. Thank you for your
Absolutely.
expertise. And again, Akila Subramaniam, she's assistant professor in the Division of Maternal-Fetal Medicine at the University of Alabama, on the front lines of dealing with all this. And you heard it here. Get the vaccine. It's important. It could save your life, save your baby's life. So very important. But thank you, Akila. Thank you very much. And I hope you have a great rest of the week and weekend.
Yeah, you too.